I'm Dr. Rick Greene, a member of the medical school class of 1970 at the University of Virginia School of Medicine. And it's my great pleasure to host this series honoring our faculty, our outstanding faculty at the University of Virginia School of Medicine. And today it's my pleasure to talk with Dr. Richard Pearson, better known as Dick Pearson.
Thank you.
Thank you for being with us.
Oh, you're welcome. Good to be here.
So I guess the first thing I'd like to ask, you went to the University of Michigan.
Correct.
I think you're true blue, as they say. I guess. I don't know. Is that true
I
or
love
not true?
I love the Cavaliers, but
Okay,
I
excellent.
will say during football season I regress on occasion.
So you went there for college and med school. I guess the first question, what brought you to Charlottesville? What brought you to the university?
Yeah, well, that's a good question. When I finished at Michigan and was looking at residency programs, I interviewed at a number of them. The one that I found most collegial and supportive was in Rochester, New York, University of Rochester, Strong Memorial Hospital. So I matched there. It was my first choice. My wife and I headed east to us from Michigan and Ohio. It was a great faculty, a great experience, and it reinforced interests that I had in global health. And I'd been in Sierra Leone, West Africa, as a medical student during my fourth year. And the program director, Bill Morgan, said he thought I should maybe consider that after residency, and had ties in Liberia. So we followed through on that. I arranged a position for a year at the John F. Kennedy Medical Center in Monrovia, Liberia, through a University of Rochester alumnus. And about the time we were getting ready to depart, he appeared back in the U.S. to stay, but said, "You all go ahead and go anyway." So we did. We spent a year teaching and doing general medicine, and at one point I was the Department of Medicine, the only internist in the country, and was responsible for caring for some of the embassy folks as well as the Liberians. Returned to Sierra Leone, decided to do international global health and tropical infectious disease research. Returned to Rochester for my ID training, and then learned through Gordon Douglas about the global health program here with Dick Grant, Jerry Mandel, Ed Hook. So my first trip to Charlottesville was really unique. I flew to then National Airport, Reagan National now, and there was a small plane, propeller plane, that sort of sat up like this, that flew to Harrisonburg, landed, came over the Blue Ridge, and then landed in Charlottesville. And as I was coming over the Blue Ridge and looking around, I thought, this is more rural than Liberia. And Dick met me, and we passed U-Haul, and he was extremely excited about a new basketball recruit, Ralph Sampson, who just had signed on at the University of Virginia. But I was struck immediately both by Dick's warmth and collegiality and hospitality, but everyone I interviewed with, and with Jerry, Jack Waltney, who is head of the epidemiology hospital infection control group. And I met Ed Hook later. He was on sabbatical at that time, but with Ed and his ability to work with and lead and inspire people. So it was an easy decision to accept the job offer here. And then with Dick, I started collaborative work in Brazil, and that has continued to the current time. So for my first 9 years, I did research, taught clinically in general internal medicine and infectious diseases. And then at the 9-year mark, I noticed that I was having a second cup of coffee before I came in the morning. And I just sort of felt somehow maybe a change was coming. And shortly after that, my secretary said, "Bob Carey, the dean, called today and wanted to talk with you." And I had rounded with Bob on the general medicine service and gotten to know him a little bit. I really hadn't talked with him probably for more than a year or two. And he said, well, there was an opening in student affairs. Jim Craig was retiring, and they'd actually offered the job to someone else from the Midwest who couldn't come. Would I be interested? And I asked for a week or two to contemplate that, and then that was the best, well, next to proposing to my wife, the best decision I made. So I started in medical student affairs in 1989, and what a magnificent 24 years I had that followed.
So what were you able to do clinically along with your work in the student affairs area?
Well, when I started out, I was 25% time in student affairs, and I continued my lab for a number of years with active research here, and continued to run in the internal medicine service and infectious diseases service. So somewhere around 2004 or 5, I stopped my active laboratory work here, although my colleagues were doing laboratory work in Brazil, and I remained part of that. But I have continued my clinical work, and then when I retired 3 years ago from medical student affairs, I continued on in infectious diseases, and so I've been on the consult service, work in the clinic, and teach in a number of ways, and I also have been able to oversee the infectious disease fellowship.
Well, I salute you for your work around the world. I had some time in Haiti.
Oh, yes.
My wife and I spent there, but I have to ask you, with your time in Sierra Leone and Monrovia, with the Ebola outbreak,
Yes.
your thoughts on that. Looking at it from the 30,000-foot level, maybe, what would you have done differently, or what should have been done differently with that outbreak?
Well, when I arrived as a student in Sierra Leone, we sort of missed connections, and I was picked up by someone I didn't know, and it was a third or fourth number on a list, and it was a lady from the U.S. who's not medically oriented, and the first thing she started talking to me about was Lassa fever, an arenavirus infection that had killed a number of missionary physicians and nurses across West Africa. And so I guess that was the first time I began to contemplate these hemorrhagic fever viruses. Ebola was known, but really more in Central and Eastern Africa, Congo areas. So you realize that in those impoverished areas with very few healthcare workers, the impact that a hemorrhagic fever virus can have and the consequence to the staff of a hospital. So tracking that over the years, physicians and nurses died of Lassa, but usually there weren't second and third generation cases. The initial person would come in, there was some direct exposure, and then the virus must have mutated or lost its virulence. But in the Ebola outbreaks elsewhere in Africa, 80–90% of the staff of a hospital would be wiped out. So I think we were all surprised when Ebola appeared in West Africa, but given the limited number of physicians, the poverty, the lack of resources, I think you can say, what should we have done differently? I think globally we should be prepared for new outbreaks of not previously encountered infectious diseases, and we saw that with flu. We've seen it with Ebola, which was a particular concern for healthcare workers, as we all know. We're seeing it now with Zika virus, as it probably has mutated and changed our response. So there needs to be global collaboration beyond the U.S., but with the CDC, NIH, and WHO to be prepared for the next round of these Andromeda strains. And I think they're going to keep coming as microbes adapt and change and enter the human population.
Do we see that students are attracted to global health or infectious disease as they should be, or should we do something more to attract students?
Well, we've had wonderful programs here, as you know, at both in infectious diseases, Department of Medicine, the School of Medicine, and then the Center for Global Health that Dick Garant and Becca Dillingham have set up and now lead, and there's been tremendous interest in global health and health problems, and of course part of that is medical, a lot of it's public health, and part of it is economic and social stability. And so the university is extremely fortunate, and I think it's been seen as a leader across the country in this Trans-University Center for Global Health. One of the challenges, I think, is finding funding for people really working in other countries who have accrued large amounts of debt during their training.
Yes.
So there are various NGOs that have worked on forgiveness and loan repayment programs and different models, but I think one of the major needs is ways to relieve some of that debt funding. I mean, going to Michigan at a time when tuition was low and the state was funding most of my education, I paid off my debt or my wife had paid it off, I should say, by the time I was a second-year resident. But students now, the average students have, you know, over $100,000, $130,000 of debt.
Let me ask you about being a dean, and certainly being a dean working with students. What did you see were the greatest challenges to that part of your phase of your career?
Well, I don't remember challenges. I remember the opportunities and great rewards. You know, I was working with Bob Carey, who had been here several years. He started many things. One of them was the Mulholland Society, the student government, which he worked closely with to gain input from students about the curriculum, about life, their experience in medicine. So I stepped into a wonderfully collegial environment, and we worked very hard with students to maintain that. There's a whole long list of Mulholland Society presidents and class presidents that I owe a great great amount to. Deepak Talreja, early on, the two of us sat down and said, what can we do to help build esprit de corps and support amongst the students? So we set out to have a social bonding activity every night for the first week or two of classes. Some of the regular faculty pushed back and said they were missing important time in the anatomy lab, but it created an atmosphere where the students flourished, but when they struggled, there were usually ties that we had with them and were able to get them support that they needed. And my wife was very willing to follow the Craigs in having all the first-year students over for dinner in groups of 25 for lasagna. So, as one of them noted to a friend, the Pearsons really love lasagna.
Well, since you brought up the Mulholland Society, I have to tell you, I was one of the 3 students that started the Mulholland Society in 1968.
Oh, well, that was way ahead of them.
And you'd be interested. I was elected to go over and ask Dr. Mulholland if we could use his name.
Oh, wow. Oh, this is
I was a first-year student here at the
my.
medical school, so I thought you'd get a kick out of that.
Yeah.
It's just a pleasure having you today, and
Well,
you know, I want to thank you for everything you've done, not only your work in global health, but obviously your work with the students here. It's been a pleasure to talk with Dr. Dick Pearson today for our program, and I just wish you all the best.
Oh, well, thank you so much.
Thank you so much.
Thank you.